Exploring all of the ways food is impacting our body beyond just energy. We're talking about our mood as well. Dr. Angela Tran joins us this morning. It's so good to see you. Happy Mother's Day.
Happy Mother's Day. I'm so grateful to be here.
I know. I'm excited to talk about this. I think a lot of people are interested. Kind of where do you start when you're assessing the foods and how is it impacting our mood?
Yeah, well, you know you are what you eat.
Yes.
So a healthy diet, yes, you're going to have good energy, you're going to think clearly, and your body's going to function well. But if you have an unhealthy diet, it will make you sluggish, you can gain weight, but it can also lead to depression and anxiety.
Really? So what is happening between the two? Like, what is the connection?
Yeah, you know, it can alter your brain chemistry. Unfortunately, sugar, one of the common entities, can lead to addiction. And again, we can get anxious, but we can also slow down. We can lead to other depressive type of things, especially with weather changes like we're having today.
Right.
It is very important to understand the relationship between nutrition and your mental health.
So where would you say, like if a person's going, that seems like something I maybe need to assess my diet over, what are the first things you look at that you might need to reduce or eliminate?
You know, absolutely the basics. So we want to take a look at the ingredient label and look at the hidden sugars. You know, sugar is everywhere. And don't get me wrong, sugar is good for your brain and your nervous system, but in excess, that's where you can get into trouble. So as a medical weight loss doctor, that's why I teach patients how to prevent those diseases through diet and exercise.
Okay, so when you say excess, I feel like a lot of times people don't really know what that means.
Yes,
so how are you assessing that?
Yeah, you know, I'm going to give everyone my signature phrase. Double-digit protein, single-digit sugar. Okay, so when you're looking at the nutrition label, just make sure it has 10 grams or more of protein, 9 grams or less or sugar. So be a sugar cop, don't let it sneak in, and then you'll be in control.
That's actually a really simple rule to follow. And I think you bring up an important point that it's not about eliminating sugar, right?
Yes.
Because it plays an important role too.
Yep. We need to get out of this whole deprivation, restrictiveness. I always tell patients, no, ask yourself what you need to add more of, which are like lean proteins, healthy fats, you know, fruits and veggies, really fuel your body so that you can function well.
I feel like people maybe don't always realize just that you think about the physical aspect of your diet, but the fact that it can alter your brain chemistry is fascinating.
Yes, and food is medicine. So like I said, you know, you can treat food and you can treat disease, but it can actually treat you well if you put good things in your body.
Wow, that's incredible. And when you see a person who does clean up their diet, they do start to follow these rules. Can you talk about the changes you see in
Oh my gosh, thank you so much for asking. You know, it's all about self-love. That's truly what I do for my patients, is because when you feel good, you make good decisions, you're taking care of yourself, your family, you know, contributing to the world. That's really what we need, is to understand how nutrition really affects us as a whole body.
Yeah. I love it. It's top down, right?
Yes,
take care of yourself from every aspect. Well, thank you so much for coming in. We always love having you.
Thank you.
All right, we'll be right back.